Hello friends. So in today's class, we will continue our discussion related to the health sector. Okay. So one second last topic that we have in this section is the mental health. After that, we have rare diseases, and after that, it's more or less covered. Okay. So coming to the mental health, why are we reading about it? Why is it running in news at the first place? Okay, the NHRC, we know a very renowned authority. It's a non-constitutional body, National Human Rights Commission. It has expressed concern over performance of many mental health care institutions. It says that these institutions are not implementing the Mental Health Care Act of 2017. Now, what are the provisions of this act that we will see? But that's the reason it's running in news, because NHRC has expressed the concern that MHI's mental health care institutions are not implementing the provisions of Mental Health Care Act of 2017. Fine. Now, NHRC says that MHIs are illegally keeping the patients long after their recovery, so that they keep getting funds from the government as well as the relatives or the family members of the patient. Okay. So, they are illegally keeping the patients for a very long time even after they are getting treated. So, that's the crux. Why was it running in news? Now, we will be discussing about mental health itself. First of all, the definition. Mental health actually, if we are talking about the sound mental health, the happy mental health, it helps you think freely or act freely or behave freely without any stressed mind. Okay. So, a sound mental health will help you behave in society or amongst your family members or in your professional life in an open and independent manner. Okay. It affects how we think, feel and act, and also helps us determine how do we handle stress and relate to others and make healthy choices. Okay. Statistically speaking, and this is important for our mains exam, that 1 in every 7, okay, 1 in every 7 Indians are actually suffering from mental illness. And in terms of the suicide data, if we go, approximately 1.3 lakhs suicides were committed in 2019. So, that is the sorry state of affair. Even if we had an act in 2017, the number of suicides in India has still been lingering around 1.3 lakhs. Okay. So, what has the government done? The initiatives from the government side, we will be discussing here about Mental Health Care Act of 2017, but apart from that, there is another important initiative by the government, that's the Kiran Helpline. Okay. So, Kiran Helpline is basically a phone number. You call them at the time of stress. Okay. If the patient is under extreme stress or depression, they will start curing or treating the patient immediately, or else they might ask the patient to report. Okay. Report to MHIs, and at this MHI they will be treating the patient. Okay. So, it is actually only for early screening, psychological support, etc. This is the initial stage. Okay. Apart from Kiran Helpline, government also came up with Mental Health Care Act of 2017, under which mental health was initially defined, or mental illness was defined, and it also decriminalized suicide. So, we can say under this act, it was very well understood that a person who is committing suicide, you cannot charge them as a criminal act, right? The person is under too much stress to take this kind of step. So, it actually decriminalized suicide. Okay. Apart from this, it also defined what shall be the rights of those people who are suffering from mental illness. They should not be facing discrimination. They should be given admissions to hospital or access to community social places until and unless they are not harming anybody. Okay. Their access in society, in public places, in hospitals and communities should be allowed. It should not be allowed only on the basis of if they are harming somebody. Okay. So, it basically defines about the rights of patients to access facilities that includes rehabilitation services and hospitals and society, etc. Okay. It also established two major authorities. One is at central level and the other one is at state level. Central Mental Health Authority, which will be looking into the functioning of state mental health authority. Okay. And the state mental health authority will be looking into the functioning of MHIs, mental health care institutions. Okay. Now, coming to what are the challenges in implementation of MHA, Mental Health Care Act, the original concern, the concern of NHRC, why we are not able to implement MHAs. Okay. So, the most important reason NHRC says is that majority of the states, most of the states have either not implemented the state mental health authority or mental health review boards. Now, because of absence of this mental health review board, patients are unable to exercise their rights. Okay. Also, states have not notified the minimum standards of MHI. So that you should be providing, MHIs are supposed to provide such and such good nutritious food. They are not supposed to conduct shock treatment for minors. Okay, so such kind of guidelines should be provided, right? States have not provided such guidelines to MHIs. That is the problem in implementation of MHI. And the most important problem is the social stigma. Okay, we do not consider a mentally ill patient as a normal patient who is suffering from any disease. They are treated very differently. They are being discriminated. The doctors themselves are being discriminated. We do not consider counselors as respectable positions as compared to rest of the doctors who are treating the visibly, so-called visible diseases. Okay. Counselors are also equally important. This status is not being provided to them. Okay. So, social stigma in implementation of MHA, in accepting that a person is suffering from mental disease, that itself is very big, and because of which it is very difficult to implement the Mental Health Care Act of 2017. Okay. So, these were some of the provisions related to Mental Health Care Act and the discussion in and around mental health care. I gave you certain data that we can put up in the answers. Okay. Now, we will be discussing the last topic related to health, that is the rare diseases. Okay. And first of all, we will be understanding what is a rare disease. Rare disease, as the name suggests, if it is rare, matlab affecting very small number of people, then it is known as a rare disease. It is defined as a health condition of low prevalence, okay, and affects a small number of people. So, why are we discussing about rare disease? Why is it running in news? Because Delhi High Court has recently constituted a committee. The name of the committee is National Rare Disease Committee. Okay. This committee will be looking after the implementation of a rare disease policy that we came up in 2021. Okay. So, this committee shall be looking into the implementation of rare disease policy. That is the idea with which Delhi High Court has created this body. So, basically it will be a 5-member panel and it will look into the efficient treatment of such patients and prepare the guidelines for implementation of policy into action. It will also be focusing on patients which are registered in AIIMS New Delhi. So, that will be the core area. Apart from that also we will be having Center of Excellence who will be working on the research of rare disease. But the core area of focus shall be those patients who have registered in AIIMS New Delhi. Okay. So, with that idea this has been created. In terms of statistics, we need to remember this data that majority, almost 80%, very close to 100%, 80% of the patients, 80% of the rare diseases are basically genetic in nature. Okay. So, because they are genetic in nature also, it requires too much of research to be conducted in that zone. Okay. So, now coming to the provisions of the policy itself. Okay. The policy initially was aimed at 3 major things. The first one was to promote indigenous research and local production of medicine. So, we are supposed to produce medicine locally within India. That was the one of the ideas. Apart from that, it also aimed at lowering the cost of treatment of rare disease. So, because the treatment itself has become very costly, that is also because research has not been conducted sufficiently. So, because the treatment has become very costly, we came up with this policy, and to screen and detect rare diseases early for prevention, so that we will be able to cure, first of all detect and cure the patient quickly. That is the idea related to rare disease policy. Okay. Now coming to the provisions. So, basically in provisions we will be discussing about 3 groups. Okay. Group 1 consists of such kind of rare disease which is one-time curative. Matlab you go to the patient, you go to the doctor, okay, they will diagnose that yes, you are having such and such rare disease. This is the medicine that you are supposed to take, or these are the steroids that you need to take, and you will be fine. Okay. So, it is one-time curative. Matlab you will get cured in one time. That is group 1. Okay. Group 2, this is the minimum number of patients and this is the maximum number of patients. Group 2 refers to those kind of rare disease which are actually lifelong. Lifelong the treatment goes on. Okay, and maximum number of patients are coming on under this category. The third disease, the third group of rare disease are those wherein diagnosis is difficult and the cost of treatment is also very high. Okay, so that's the third kind of rare disease. Now there are certain financial support provided by government under National Policy for Rare Disease, National Policy for Rare Disease and 2021. The financial support first is in group 1. The name is Rashtriya Arogya Nidhi. Okay, for that patient will be provided with 20 lakhs. Okay, but apart from this, if the patient is not coming under category of Rashtriya Arogya Nidhi, then this is rupees 50 lakhs. Okay, so 50 lakhs will be provided to the patient if you are not coming under Rashtriya Arogya Nidhi and you are treating yourself in a center of excellence. Okay, only in that case this 50 lakhs will be provided to you. Now, where are these center of excellence located? So, there are 8 designated center of excellence. We don't need to remember their names, but there are 8 designated health facilities which will be considered as center of excellence. You can go and get yourself treated over there. Okay, and there will also be a creation of a national hospital based registry of rare diseases, so that at least we know what kind of rare diseases are occurring in India, and on that basis we can categorize or decategorize a disease as a rare disease. Okay, so with that we come to the end of the health sector itself. We have discussed so many important data that you can mention, some of the acts, some of the provisions, some of the bodies that have been created recently. More or less every topic was running in current affairs. Okay, so it is very useful for your mains. Okay, you can make use of these data. Every data is from either NFHS or the Ministry of Health and Family Welfare's website itself. Okay, I wish you all the very best and thank you so much.